Welcome, North Dakota. Thanks for tuning in.
This is a KX News special report.
Longest lead ever on a lead-in. To our television partners, thank you. Even though North Dakota's got the fastest and perhaps widest broadband in the state, we delayed to start today because there was some serious internet issues here in the Capitol. Those are being investigated. Hopefully everybody here was informed of that. And if this Facebook Live feed's not working, it is being recorded, will be posted later if you're having trouble with the feed that you're getting right now. But again, thank you all for your patience. During today's update today, we're going to be joined live by Commerce Commissioner Michele Comer and Chris Jones, who leads Human Services. Thank you two for being here. And we'll jump right in. The news for today, Department of Health confirmed 18 additional novel positives of COVID-19 out of 240 tests for a 7.5% positive. That's an increase. And again, that brings our rolling cumulative positive rate since the beginning of this outbreak to 4.3, which is the sixth lowest in the country. I'll jump right away to the next slide, which I'll call testing team effort. The real news here today is that we had a disappointing low number of tests taken. And so this is a testing team effort is a cry to for the whole team to come together across the state. There's a number of things. Anybody who's an epidemiologist would understand that often weekend data gets distorted. When we're reporting here on a Tuesday a low number of tests, that means that we had likely very few regular people calling in, walking in, or seeing a provider this Saturday or Sunday in terms of getting tested. And so that would lead, on about a 2-day lag to our low numbers today. In addition, we did not have any big targeted testing efforts that were driven by the state over this past weekend. And so coming off of a big day yesterday where we had record number of days and we've had a fallen way back to a low number today. You average those 2 days together and that still puts us at about that 650 run rate, and where we want to get to 1,000 or more on a regular basis. So to get there, again, we have the number of test kits in the state available. They're available at clinics and hospitals and around the state. Again, our providers around the state would ask that you call before you come in. And if you are someone, again, I know that occasionally we still see a story that somebody says, hey, I wanted to get tested, I had symptoms, but I was turned down. If you're one of those individuals, if you've got the energy to write a Facebook post, hopefully you'll have the energy to call the North Dakota State Health Hotline, and we'll figure out a way to get you connected with a provider and get you tested. Because the way we work our way out of this is with higher testing rates. It's important when we talk about this testing team effort, because there's so much focus these days around reopening. It's important that even the White House criteria, the guidelines that were put out, talked about having lower positives, but there was a caveat. It was lower positives if you had a higher absolute number of tests being taken, equal or higher number of tests. So getting lower positives, just lower physical number of positives just because you're testing less does not meet the White House criteria for reopening. So again, we're asking for those folks out there that if you think you need a test, keep advocating for yourself until you get one. We're at the state going to take the efforts that we have already deployed successfully in multiple counties across the state, Slope and Stark and Montreal and Grand Forks, and we're going to be driving that up even higher. We've of course done some of that in Cass County as well related to long-term care, but we're planning numerous more rapid response teams going out to make sure that we can coordinate with local health officers and with local providers to make sure that we're getting as many tests as possible. Back on testing data, Again, with that big surge that we had yesterday of 1,117 tests, we did move up to 9th in the nation on per capita testing rate. It's possible to drop back down to 10th tomorrow after the lower day that we had today. Our positive case rate at 4.3%, which was on the first slide, we're the 6th lowest in the nation, so we're dropping there. Dropping is not a good thing, but we're now behind Hawaii, Alaska, Montana, West Virginia, and Wyoming. In terms of the currently hospitalized, we're at 17, and that is the same number, but that's there is a put and a take in there, which is that one person was released and another person entered, and happily we've got no additional deaths to record. In terms of the case trends that we have in the state, again, this distortion of data with having a very low testing date yesterday, it looks like we've had a drop in the curve. I would caution anybody from thinking that that's actually the case. Just again, at the 4% to the 7%, 4.3 being our cumulative run rate, 7.5 being yesterday's. If you took a range of that many percent positives, if you can go back to that prior slide, if you could take a range of 4% to 7% and say we'd done another 800 tests and we tested 1,040 instead of 240, then our actual number of positives we'd been reporting today would have been between 50 and 74. And so there's not a chance that I believe that we only had 18 positives in North Dakota. I just know we tested less. And so we should think about the number of positives that we have in that range, because nothing to indicate that that's not the case. And with that, we did have on Sunday, again, when you've got less people being seen clinically, Sunday we reported 0 recoveries. Today we're happily recording, after a Monday with people back seeing their providers, 25 newly recovered cases, and 25 newly recovered cases is a record. And so a combination of a Monday's worth, perhaps a weekend's worth of recovered, combined with the lack of testing, we saw a net -7 decrease in active cases, and that's why that chart drops down when the reality is, by all measures, is that the number of active cases surely went up in North Dakota in terms of if we had been able to keep testing at our prior run rate. As we take a look at the increased rate of positives with this 7.5% that we had even today on a slow day, this is the chart that's going the wrong direction. Positive rate of completed tests is one of the White House measures that they're looking for in terms of whether or not you would reopen. So again, we have more work to do in the days ahead to try to turn the corner on this, and the way we do that is continue to follow all of the North Dakota SMART guidelines. The reason why we had such low numbers for so many weeks was a combination of geography and distance away from the outbreaks, but it was also a combination of the great compliance that we had around the state. So again, for those that want to reopen, our path to doing that is to making sure that we have the capability to manage current and future outbreaks, and to make sure that we can, when necessary, slow the spread of this contagious disease. Next slide that we'll talk about has to do with, or the next topic we want to talk about has to do with long-term care. As I've said, one of the criteria for reopening, one of the 8 criteria that we focused on, is whether or not we've got in place comprehensive and rapid ability to respond to outbreaks that would occur in long-term care facilities. We know that from the beginning of this, in Kirkland, Washington, where 35 people died in one facility, or in New Jersey, where recently as 70 people passed away from the same facility, we know that this is one of the most challenging parts is how to manage this disease in a congregate living situation. In Washington, there was still little known about coronavirus, or perhaps even what it was. In New Jersey, at the time when they had that impact, they, like the greater metro New York area, were constrained in terms of their healthcare capacity, and so in many cases they didn't have an opportunity to move or isolate people. So today we're going to be announcing our North Dakota SMART. what will be called the VP3, the Vulnerable Population Protection Plan. So ND Smart VP3. This is as we have approached this entire crisis through this whole thing, is that we want to make sure that we've got coordination across providers that might have been competitors, in working to make sure that we're coordinating across geographies and regions to ensure that hospitals, long-term care facilities, intermediate care, and other congregate care facilities have the resources to prepare and handle for COVID-19 patients. There's been a lot of focus about, do we have enough ICU beds, and do we have enough ventilators, and do we have enough staff? And the answer to that is yes, because of all the great work that's been done by our team and the planning that's been done and the providers and the collaboration there. But additionally, we wanted to add to that and put out a plan that enhances the ability of our rapid response team, whether that's testing, whether that's supporting and cleaning. In Georgia, the National Guard has proactively cleaned over 500 long-term care facilities to assist the stretched staff at those locations. And so again, we want to be in a position to assess, advise, and assist these facilities where a positive case has been identified. We're fortunate that in North Dakota, out of our 218 facilities, only 13 so far have identified either a staff member or a resident who is tested positive. In contrast to Minnesota, they're reporting today 87 facilities, and they only report, according to an asterisk on their website, only those that have 10 or more positives before they get into that 87. So the number apparently is substantially higher than that. We've had some outbreaks here in long-term care facilities and other congregate living facilities. We have an opportunity to act quickly, and this is a place where we really can work to save lives. And so again, to provide for a deeper explanation of what we're going to do in terms of this, the Vulnerable Population Protection Plan, or VP3, the key items on this is not only is protecting those, it's minimizing staff movement across facilities or within facilities, because isolating, making sure that staff aren't the ones that are carrying it across. We want to identify and isolate positive cases to slow the spread, and we want to have these rapid response teams that come in. And bottom line is, if we've got this healthcare capacity, if we've got beds available in our state, there's no reason that we shouldn't have an expectation that if we have a positive case in a long-term care facility, that we're able to isolate that person either effectively within that facility, or if necessary in another facility where they can receive equivalent or better care, including again, the coordination between our excess capacity in hospitals and long-term care facilities. So again, there's been a lot of work that's been done on this by a lot of people, but pleased to have Chris Jones leading that effort. He's had a full plate managing all kinds of things across his role in human services, but here he is today to talk about VP3. Chris, thanks for being here.
Thank you, Governor. Wanted to start with what does this really mean, and I think it's important all of North Dakota understands what's going on. Many families in North Dakota have loved ones in different settings depending on their stages of life. And sometimes that's due to a developmental disability, sometimes it's due to a physical disability where they are, in essence, required to live in a group or congregate setting. Given the virus, we know these settings add additional risk for the residents and their caregivers. We're asking people to go into an environment where it's close contact, close quarters, and we need to do everything not only to protect the individuals but the caregivers. To that end, we need to significantly enhance our efforts with additional resources and additional leadership to support the individuals, the families, and the caregivers as we try to navigate these different times. Unfortunately, as the governor just mentioned, North Dakota has had some outbreaks across North Dakota, and we must do everything we can. We must do more to better serve. And with that, I also want to add, I think when we look at these providers who have outbreaks, you have to assume the best intention when they go in and they care for people. So even as we go through this and we hear of places where there are individuals who become infected, caregivers who become infected, we need to all work together to solve the problem and not blame the provider or blame an individual for this. I've talked to a number of providers who really want to do what's best for their staff and, more importantly, those they care for. So to that end, we will be working much more closely with providers across all provider types, including hospitals, nursing homes, and other congregate settings such as intermediate care facilities. And just to define what an intermediate care facility is, they're residences where individuals with developmental disabilities reside. And sometimes people in a intermediate care facility are at even greater risk than those in nursing homes, given they have compromised immune systems, they are on ventilators, they just have needs that need to be met that put them at significant risk also. The goal is to work together as a state to ensure that citizens of North Dakota in these settings are in the safest place possible, which may not be where they are today. To that end, we will also be providing more guidance and will be much more directive on where and when a resident or patient can be transferred or discharged, and the protocol to reduce the risk to the individual and those in their housing setting. We must be more directive as a state where these individuals can live to protect them and their caregivers. We will also be enhancing the work of the rapid response team to quickly assess, advise, assist, and specifically direct transfer from congregate living facilities when they have a positive patient or staff member. The team will work with facilities to ensure proper infection control and will be a trusted resource to offer technical assistance. We intend to kick off this enhanced effort tomorrow, and it will be developed over the coming weeks, along with the announcements made yesterday on testing and contact tracing. As the governor said, North Dakota is fortunate to have healthcare resources that we have, and quite frankly, we more than believe we have enough, which makes all of this possible. And now we must deliver on delivering care and protecting those who are the most vulnerable. While the state has invested in care for the vulnerable, we all must be willing to use a growth mindset, think differently, and be open to change at the local level to protect those who can't necessarily protect themselves. Thank you.
Thank you, Chris. Appreciate both your empathy and your action on this important step that we're taking. I want to also just say again, for those to understand that the world has changed not just because we've got a new virus, a deadly virus, particularly for those that might be in congregate living situations. We've also got an entirely new set of flexible rules from the federal government in terms of waivers that have come through. So where in the past it might have been a standard practice to take someone who's leaving hospitalization to, quote, step down and go to a nursing home as their next level of care, and some of that was appropriate care and some of it was driven by policies built around reimbursement rates. And with the new flexibility on reimbursement, we have to work together to think about, again, the key thing here is isolation and saving lives. So if we have a positive in nursing home, how can we have that individual well cared for and separated from others to slow the spread? And how can we not reintroduce into a facility? Again, we're doing a great job of restricting visitors, but staff have to come and go every day. And so staff protection is equally important. And part of this is also going to go back in, as we talked about, us really ramping up our testing. And one of the ways I think you're going to see the numbers go up this week on testing is us getting out and make sure we can do testing of folks that are working in care facilities, doing that great work on the front line of this to make sure that they are also all clear in terms of their ability to work in those environments. So that's the summary. Thank you, Chris, for being here. Chris will be available for questions afterwards. Next up, I want to talk about one executive order that we're amending today. And this relates to one that was issued on March 26th related to the State Health Officers Authority, related to confinement orders. And again, there were some questions yesterday and has been related to the difference between isolation and quarantine. And I want to cover that first. Isolation is when a person who is showing symptoms of disease separates themselves from other people to prevent spreading the disease to others. So this is if you've tested positive or if you've actually have the symptoms. Quarantine is an example when we've got someone who has a known exposure to someone who had the disease but does not yet have the symptoms. But they quarantine themselves, separate themselves for a period of time to prevent potentially spreading the disease to the other. For this particular disease, COVID-19, 14 days is the recommended time from the last time an individual was exposed to a case. Well, the case was contagious. So again, that's the definition of isolation for people with symptoms, quarantine for those that are not yet showing symptoms, but they're both separating themselves to prevent the spread. Since the March 26th order, local health units across the state have been doing a great job dealing with community members who've been infected or exposed. And in some cases, a small number of those, less than 20, we have found cases where people have been either unwilling or unable, perhaps due to housing, to comply to the state health officer's confinement order. These individuals, because they're in a position where they're either could be infecting others or potentially infecting others, represent a public health risk, and they do require the individualized confinement orders. And what we're driving with this revisement here is allowing local health officers to take action through a whole community approach, and then they can respond better on a case-by-case basis through isolation or quarantine orders for community members. And so this is about local control and local engagement and making the best decisions locally. This order does not impact the oversight authority of the state health officer, and it's critically important that we continue the great collaboration between local health officers and the state. So that amendment is out and posted. Next topic is going to be Care 19, I believe, and but as we maybe as a setup to that, we can talk a little bit about the step-by-step reopening process, and we'll highlight again on the step-by-step reopening that we had some criteria. One of those was widespread rapid testing, and you heard us yesterday announce that Brigadier General Schulte is leading that effort, and as it relates to contact tracing and a robust thing, Vern Dosch has joined to lead that. We're very excited to have both of them in place. And the key topic here that I'm going to talk about is Care 19, and then we'll come back to the standard process for reopening. But Care 19 is one of the elements that really relates to the contact tracing, and we're excited to announce today that we're launching the much-awaited version, the Android version of Care 19 is coming out today. I see some fist pumping going on right here in our limited audience, but I want to thank those over 20,000 individuals who downloaded the iPhone version of that and have already enabled their location services. Remember, Care 19 app is entirely voluntary, but again, we want to highly encourage everyone to help us improve our ability in North Dakota to better scale and efficiently do contact tracing. This is one of the things that's going to allow us to reopen. Your privacy is essential, and having privacy was at the core of the design of this product. The information that's collected about location is not associated with you, not your phone number or any of your other personal information, not your email address, and the app is free for individuals to download. The Care 19 app is also going to keep getting better. We did have some questions yesterday about location. The new version is going to offer improved location tracking and other capabilities. It'll also incorporate joint Bluetooth proximity tracking. Many people that follow tech probably saw the really incredible announcement that Apple and Google, the two largest phone providers in the world, they announced a few weeks ago that they were going to figure out a way to get the algorithm, because each of them use different approaches for Bluetooth, that there's going to be interoperability between the Apple and Google platform on Bluetooth proximity tracking, and the Care 19 app will be able to incorporate that capability. And again, what's the primary benefit here? The primary benefit, of course, is saving lives and helping us get reopened and going. But what it will allow is when, again, in an anonymous way, down the road, let's say it's next fall, and you're at a large gathering event, and there's been a breakout, and there's somebody who tested positive who was at that large event, anybody using Care 19 could get a notification that said you've been at a place or in a location where there have been other confirmed positives, or where confirmed positives have also been, so that you can proactively take steps to help reduce the spread. And we can notify you based on a 36-digit randomized anonymous number that is assigned to you. And so we're not sending it to a person, we're sending it essentially to a randomized number who we don't know who that is, but we know that phone has been in a place where there'd been positive contact. So again, takes care of privacy, but has the ability to alert you. And this is one of the tools that will allow us to get back to having larger events. On the back end of contact tracing, right now, as I've explained before, historically, when there was only a few number of cases around something, say like Ebola, that was, again, infectious and deadly, but had limited spread, contact tracing could be done in a largely manual basis. We need to build in the back end infrastructure to support this. You can see an example of what's happening in Grand Forks with the LM wind plant, where we have over 900 members that work there, tracking all of the individuals and who they may have come in contact to. Quickly scales up to a very large mathematical number of people, and we need to have the back-end infrastructure. And again, with Vern Dosh's background in the software industry, this is going to be very helpful. The state of North Dakota had an existing contract with Microsoft, and so through an existing contract, we were able to quickly stand up Microsoft Dynamics CRM solution, CRM meaning customer relationship management, because that's really what this is in terms of a tool, and we'll be able to track those cases and improve this electronic case management in coordination with local public health officials. And this automation is gonna help us be quicker and more efficient and save state tax dollars and time and money. So again, to help on this, please download and use the Care 19 app. Get it from the App Store and now the Google Play Store, and the links to that can be found at the ndresponse.gov COVID-19 resources Care 19. And you can help us with the North Dakota Smart Restart, and you can help us save lives. Okay, next up, we're really pleased to have Michele Comer here today from Commerce, and she's going to talk us a little bit through some of the work that's been done by our economic resiliency team and what's going on in terms of North Dakota Smart Restart. Getting lots of questions from business owners that are navigating through these challenging times, but we want you all to know that as someone who spent my entire life in business, and including small business, both at the beginning and sort of the end of my career, understand all the trials and tribulations and all the heart and energy that you've poured into building those businesses. And while there are a lot of federal programs that are out there that are providing unprecedented support, we know that in some cases this isn't enough or isn't coming close to meet the need. And so we want to continue to listen, continue to work with you. And of course, what we want to do is get this virus behind us so that we can get our economy open and rolling again. But the team at Commerce is working around the clock to do that, and under the great leadership of Michele Comer, they're making a lot of progress. And here she is. Michele, thanks for being here.
Well, good afternoon, North Dakota. As Governor Burgum said, my name is Michele Comer, Commissioner of Commerce. These past 5 weeks, the Department of Commerce has dedicated resources to help North Dakota businesses understand the CARES Act and the federal resources available to support small businesses during this trying time. Partnered with other state agencies, as well as the Greater North Dakota Chamber of Commerce, we have served more than 7,000 people through our 5 weekly business briefings. These efforts paid off, as we learned last week that North Dakota small businesses received more than their share of the pie, so to speak, more dollars per capita per small businesses when it came to the Paycheck Protection Program loans. Feedback from employers with multi-state businesses indicated that the leadership and support provided by our state government team was unrivaled in other states where they conduct business. We know there remains a need for additional financing for small businesses, and we are not taking our eye off that ball. We are carefully monitoring the deal that Congress is working on as we speak regarding additional funding for support programs, and we will bring more information to the business community when that information is ready. In this past week, we have pivoted to turn our attention toward North Dakota's Smart Restart. While the governor's office and the North Dakota Department of Health define the when, the green light, so to speak, based on things like infection control, infrastructure for robust testing and contact tracing, PPE availability, and as Chris said, our ability to protect our most vulnerable, the Commerce Department is working with industry work groups to prepare for the how. How will we safely reopen businesses that have been closed to protect against a rebound, to inspire consumer confidence, and to ignite our economy? Late last week, we began to extend invitations to associations that represented businesses that were closed. And using our networks, industry leaders where there were not associations, we formed groups. Since that time, we have established 6 separate working groups with members that represent the businesses closed by Executive Order 2020 6.3. The membership represents the diversity found within our businesses in our state, both rural and urban, large and small, sole proprietors and franchisors. And in North Dakota fashion, even when asked to be available immediately, to volunteer an abundance of time this week, everyone we talked to said yes. Workgroup members are aware that they are representing not just their own business, but their industry, and speaking for the greater good. Now, the goal of these work groups is to arrive at a North Dakota Smart Restart protocol that is both practical and effective at controlling infection and inspiring consumer confidence. Because we believe that in North Dakota, with our hyper-connectedness and our willingness to come out and support one another in times of crisis, even if we are competitors by day, that we will succeed at both reopening our economy and doing it safely. 4 of those 6 work groups met this morning, and the reports from those work groups will surprise no one. Each report emphasized the high level of commitment, cooperation, support, and mutual problem-solving attitude. Let me stop and express gratitude to those North Dakota citizens and business persons who volunteered their time and energy and passion on short notice and put North Dakota first, and also the team at Commerce that reinvents itself almost daily. It's our goal that in the coming days, each of these work groups will have a recommended protocol to safely reopen the businesses that were closed by executive order, with the exception of theaters, athletic centers, music venues, and recreation centers, which are by their very nature congregatory places. Those businesses will be addressed in the next immediate phase. After these recommendations are submitted, they will be then shared with the North Dakota Department of Health and either approved or returned with questions and suggestions so that we are ready when our health metrics suggest that the time is right for a North Dakota Smart Restart. Thank you.
Thank you, Michele. And again, Michele will be here for questions afterwards. Unemployment is the next topic, and regular claims that came through 1,329. 210 on the pandemic unemployment, 260 on the pandemic emergency unemployment claims. And again, those are all slower than they were at the peak. That brings regular claims since March 16 to 53,773. The pandemic unemployment assistance claims to 6,453, and the pandemic emergency unemployment claims to 6,672. We know that there have been, due to calls and challenges and everything that we are having, again, in terms of getting one of these categories, the pandemic unemployment assistance claims, getting the checks out to individuals. We know that these insurance payments, unemployment insurance, are a critical necessity for each of you, and that would again be the 6,453 people that are in that. These were people that were self-employed, gig workers and others, contract workers who may not have traditionally qualified for regular unemployment compensation, extended benefits, or the other pandemic emergency employment compensation. So we know this is particularly important, and we know that any delay can create real hardship for these contract employees, some called 1099 workers. But as we're working as fast as we can to implement this program and to distribute these funds, we're expecting to receive final guidance from the U.S. Department of Labor tomorrow. And I want to commend our job service team for working proactively with the program on the North Dakota side, putting us in a good position to hopefully implement quickly once the final guidance is received. But when that final guidance is received, in terms of program guidance, then we actually have to program reprogram the aging mainframe, which I've talked about before. And once that computer programming is completed, we'll begin to issue those payments. And when we issue them, we'll include all the back payments back to the dates when people first applied. So again, I know how hard this is, but again, thank you for your patience. And please know that our team is working as hard and as creatively as we can, and they're literally working around the clock, both directly and with outside vendors we've hired to implement this program and distribute the needed funds as quickly as possible. And again, we can give you updates going forward on that, but again, we hope to and expect to receive final guidance from the Department of Labor tomorrow, which is another hurdle we need to keep moving forward. In our closing three segments, we've got behavioral health, good news, and gratitude. Behavioral health update. Of course, we know that the stress associated with created by the COVID-19 emergency can place undue pressure on individuals that are in recovery from the chronic disease of addiction. And we in North Dakota created a really fantastic program a couple years ago, and this was in connection with our Department of Corrections, the behavioral health team, the legislature, Office of the First Lady, and others have all been involved in making sure that this thing got off to a great start, was well understood, but it was called North Dakota Free Through Recovery. And again, this really was focused on serving people that had behavioral health needs and had prior criminal justice involvement, and likely that involvement related to the disease of addiction. Currently, there are 1,160 individuals who are receiving services and support from over 35 providers. There's more than 150 care coordinators. That was the new position that was created. 60 plus peer support specialists continue to deliver during this crisis great services and supports to assistant participants to help them overcome barriers and reach their recovery goals. I want to give a real shout out to the care coordinators and the peer support specialists, and again, all of those that are working in these positions and particularly those that have got lived experience, meaning they themselves have successfully been on a path to recovery. They themselves may have been intertwined with a disease of addiction, or they themselves may have had an interaction at some point in their life with our criminal justice system. But those individuals that are involved in these roles are literally our role models that are shining lights that are helping people move forward. And of course, for those that are wondering how this fits in and how this is paid for, a cost of incarceration in North Dakota remains at over $41,000 a year. And if someone goes through recidivism or ends up back in that system because of a infringement or crime related to their addiction, it's much more cost effective for us to be treating the disease versus incarcerating people with the disease. And so this makes a ton of sense in terms of being the right thing to do and also the financially smart thing to do for taxpayers. So this is a win-win-win all the way around. Program participants during this emergency are continue to receive COVID-related communications and ideas related to housing, employment, recovery support, food, transportation, and tech support for video communication. Because again, this is a pay-for-performance program. People that are involved in this, that are working as care coordinators, are compensated more if they can help their clients achieve some of the basic social determinants of health. That includes getting a place to live, getting a job, and getting a driver's license, and all the things that many might take for granted, but are absolutely needed if you're on a road for recovery and coming out of the criminal justice system. So I want to express deep gratitude to all our providers, the care coordinators and peer support specialists who continue to serve others while navigating the impact on their own families. I want to thank Pam Sagnas and her team in behavioral health, and Chris Jones and their leadership. I want to thank Senator Judy Lee and others in the legislature who also helped pioneer this. I want to thank Chris Jones. I want to thank Leanne Birch, and of course I want to thank our courageous First Lady for championing all those people who've had the challenge to deal with the disease of addiction. Next topic is good news section. In today's good news, maybe slightly old news, at least for one person who's listening, because radio legend Dave Thompson already beat us to the punch and featured this story as a good news story on Prairie Public, but we wanted to as we say, give a little top spin and some others to know about what Dave's already reported on. And as we work through the spread of COVID-19 in North Dakota, there are plenty of low-tech options that are extremely effective. One of the best possible ones is just washing your hands and doing it well. Practicing physical distancing, which I learned another good tip on the other day, which is if you want to be more than 6 feet apart, that means that if you've got your arms out and somebody else has got their arms out, that means you're not touching hands generally, because assuming, and add a little if you're shorter, because for most people their wingspan is about equal to their height. So if you're below 6 feet, add some more, or if your arms are extra long. In some people's cases, you don't have to, but anyway. We have some high-tech ways that we can also help us slow the spread as well. And right here in North Dakota, we consider ourselves to be a leader in unmanned aerial systems, which we are across the nation. And Skyscopes is a UAS company in Grand Forks. They're collaborating with the University of North Dakota, the Center for Innovation at UND, the Research Institute for Autonomous Systems, UND's Medical School, North Dakota State University in Grand Forks County to answer that question. And they've got some ideas about how UAVs might help spray water and disinfectants to stop and kill the virus, and to understand how drones might deliver medical supplies, or they could also be used in trying to detect health issues. So again, those are some great examples and some great innovation of how UAS could be used in a health component. I want to thank all of those that are doing research. Again, great private-public sector innovation going on there. In our closing and our gratitude section, I'm sure that many of you have been saying to yourself, why is he wearing a purple tie today? And the answer to that is that today, April, is the month of the military child. Today, this very date today, on April 21st, is Purple Up for military youth. So today in our gratitude section, we want to say thank you to the many military children in North Dakota for their support of their parents and their own courage and sacrifice. As we say all the time when we're working with either the National Guard or active military in North Dakota, and any of you who have served, we thank you, but you know the idiom or the saying that goes with this, which is when one individual serves, the whole family serves. And today we want to recognize the more than 10,500 North Dakota children who have a parent or step-parent who's serving in the military. And many more beyond that 10,500 also have siblings or grandparents, aunts and uncles who serve, but there's 10,500 direct descendants of people serving. We recognize the incredible strength and resilience of these children who in a way are certainly in a way serving alongside their loved ones. They experience deployments and the pain of separation from a loved one, the stress of not knowing what could happen, changes in their household, their duties, their schedules, along with many other challenges that go along with being part of a military family. And now we throw all the COVID changes on top of that. We are continually grateful to the brave men and women who serve in our National Guard, in our military, and the armed forces for their courage and their sacrifice. And today we encourage all North Dakotans to recognize this selfless courage and the incredible sacrifice of our military families, and particularly today on Purple Up Day, recognizing those military children. So you can join me in wearing purple. And if you don't have any purple in your closet to throw on this evening, we want to, again, take a moment and thank those amazing young people and their families for their service. And as has been said by author Randy Rausch, showing gratitude is one of the simplest yet most powerful things humans can do for each other. And today we extend our gratitude to all those military children. With that, we'll stand for questions. We're going to again go online first, and then we'll go lane, and then we'll swing over this way.
Robin Travers with 660 KYZ in Williston. Will North Dakota have the necessary capabilities to reopen safely on May 1st? And does the state of oil have any impact on the length of mandated closures?
TBD and no. I just thought for all of you that I would answer questions with a yes or no for the first time that you've been together in over a month. So, but to be seriously on Robin's question, the first one is whether or not we're going to be able to reopen, and it depends on whether we can continue building those capabilities. But, you know, do we have enough beds? Yes. Do we have enough PPE? It sure looks that way. You know, testing, as I said today, put out a call for everybody. We've got a North Dakota-wide, all the providers, all the individuals. We've got to get our testing numbers up if we want to get reopened. Contact tracing, you know, we've announced new statewide leaders. We're putting more resources and more emphasis to build those muscles. And there's a lot of time between now and May 1st. But the virus doesn't understand the calendar, and we've got to be ready to go. The oil price, we talked a little bit about that yesterday. Obviously, that's a big concern for budgeting, but the price of oil is not something we can control, and it's not anything that's going to influence we can't take something we can't control and have that influence a decision on whether or not we'd reopen. So I would separate those two things.
If I can just quickly jump in on the follow-up on that. Ultimately, it comes down to your signature. Gauge your level of optimism for May 1st.
Well, I'm confident that we're going to continue to make great strides between now and then, but I can't predict human behavior. I can't predict. I think that as we're seeing other parts of the nation start to open up, the pressure will continue to increase here. I predict that compliance will start to erode, both combination of sort of cabin fever, fatigue, and also spring weather in North Dakota. And so I think we have the potential to see compliance go down, which could help infections go up. And again, what was announced here by Chris today, if I can get more confident about our ability to really protect those people that are in long-term care or congregate living situations, then we're taking less risk literally with people's lives when we think about opening up. But again, having said that, when we were talking about opening up North Dakota style, let's be really clear. When Michele was up here talking about businesses and working with people to reopen, that does not include energy, agriculture, healthcare, or education, because they're all open. Okay, we're only talking to those small segment of the economy where we actually put in state mandated closures, personal care businesses, bars and restaurants, et cetera, you know the list. But that's a small portion of the economy. Everything else is open. If some other business is voluntarily closed, they have every option to decide today that they want to reopen if they voluntarily closed. You know, hospitals, that stopped doing elective surgery can start doing elective surgeries today, tomorrow, if they see fit to be able to do that. So again, I want to make sure that we're talking about let's not let the national discussion blur into North Dakota about what's open or closed, because a very narrow part is here, and we've got more open than almost any other state already. So in some ways, people say we should lead the nation. Well, we are leading the nation because we've already got more open than most other states do. Lane?
Governor, today I talked to a man who is a construction worker and already receives unemployment at this time of the year, but his unemployment has now run out and he's applied for these expanded pandemic benefits. He wasn't receiving them, so he was trying to call job service offices across the state. One of them finally told him, because of these guidelines that you guys are waiting on for the Department of Labor, that without those they can't send those benefits out. Is that true?
Well, it's true if that's the program that he qualified, if it's true, if it's what he qualified under. But I know that the pandemic unemployment assistance, the PUA, has to do with independent contractors. So if he's an independent contractor, this would provide 13 weeks. If he can qualify under the pandemic emergency unemployment compensation, that offered an additional 13-week for people that might have seasonally been laid off in the wintertime, because there's a group of people that file for unemployment every winter, and then normally in the spring right now they go back to work for their same employer. Their employers pay a lot of unemployment insurance as a way to manage through the winter, and those individuals, if they're not going back to work, can get an additional 13 weeks of benefit. So it would depend on which program he would fall into, because one of them is being paid, the other one's waiting for advice. If it's the PUA one, that's the group I described, where we're hopefully tomorrow we'll have the input from the Labor Department and can get the computer programming done and get checks going out.
I'm wondering if there were any specific events that prompted the amendment to the executive order you made today.
No specific events, but just reality where we're working with local public health officials and making sure that we've got the dial turned correctly in terms of making sure that where local control and local decision making works best, that people are empowered to do that. Dave?
I've got one for Chris Jones.
Great, thank you, Dave. Chris Jones coming up to the podium.
And this, because you did talk about people with disabilities, there was some concern about that. In apparently a couple of states there have been lawsuits or complaints filed about how they're treated. Do you think that you have enough safeguards to make sure they're treated correctly and they're not discriminated against?
Well, the short answer is yes, absolutely. I think if you look at North Dakota, even as it relates to individuals with developmental disabilities and the work the state has done since, quite frankly, the 80s, we're seen as a leader in the nation as it relates to that. With physical disabilities, just as much. I think what we're trying to figure out how to do here is one of the things that relates to all of this, we're talking about where people live. And now we're saying you may have to move because someone where you live is infected. And how do we make sure that they understand that we're moving them for their own safety and for them? So all of this is emotional in nature, and we're asking people to leave where they are right now and the people who they work with and care for them. So while it might sound easy in some ways, I mean, it's still a logistical effort. There's the emotion part of moving people around. And I think some of you are aware of the Olmstead and making sure people are in the least restrictive environment, and we have to take that into consideration as we move folks around. And sometimes we may have to move them into a more restrictive environment only because it's where they will be safer. So.
Was that another question for Chris? Okay, don't get too far away.
Disability advocacy group told us that they have written a couple letters to you guys asking about guidance to support some of the treatment for people with disabilities. Have you received any of those letters?
Yes, those letters have gone to the Governor's Office, Department of Health, and Department of Human Services. They cover a wide range of topics. The short answer is we continue to follow all of the ADA guidelines and treat every individual with the same level of respect, regardless of the disabilities that they have. I think where the letters are coming from are from the standpoint of in some cases, like if you compare to New York, and where hospitals need to triage resources, how is that triage being done based on the individual's health? And so I do know in New York they triaged more based on physical, where they were, if they were stage 4 cancer, if they had COPD, diabetes, and a number of different comorbidities, would they be eligible for a ventilator? And at this point, we're not even close to that point. Like the governor and many have said, we have more than enough healthcare resources as relates to that. Secondarily, the Journal of American JAMA, the medical journal JAMA, I forget what the acronym stands for, but there are ethics guidelines. Hospitals have ethics guidelines. They need to make those determinations as it relates to that as well. So at this point, there's not really, I'm aware of the letter, trying to understand the letter the best we can, but from if I'm a family or someone with a developmental disability or physical disability, I wouldn't have a lot. I would say based on all of the assets and resources that we currently have in the state and the projections that are out there, I wouldn't have concern.
We'll go online and then back to Jacob.
April Baumgarten with the Forum of Fargo-Moorhead. Are there any updates on where North Dakota plans to go next to do surveillance testing, and have other states contacted North Dakota for advice on how to do that?
We have plans, but none of them are announced yet, ready to be announced today. And when we do those, we'll be generally announcing those locally at first, and then reporting on them afterwards to make sure that we've got the right resources. And then other states, we're in constant communication with other states. I was on a call last night with about 20 governors, lots of information sharing, going back and forth between states about activity that's going on. And I think, again, we have know that we've got some nice kudos from Dr. Birx last week relative to the work that we were doing on surveillance testing. And so that was, we know that there's been recognition at the federal level for what we've done so far, but we want to take that to a whole nother level going forward, meaning, more of it than what we've been doing. Jacob?
Governor, the FDA approved a new form of mail-in COVID-19 testing. Wondering if you think they would be helpful and if you think they'd be reliable.
Well, I don't think the FDA would have approved it if it wasn't reliable. And again, at my understanding, this is several weeks away from availability. It's being delivered by some of the national labs, and it would first be available for frontline EMS and healthcare workers. So, while it is a take it at home self-test, is you swab up each nostril, put it in an envelope and send it off to a national lab, and then you find out your results on a secure website. And so again, that's a great, disruption brings innovation. That's a great innovation that we have that and that's coming. But again, we're not quite at the take it at home, because again, the people that would be doing those self-swabbing would be people with medical training, would understand, how to do that to make sure they're getting a good sample. But I think again that we're going to continue to see more innovations like this on this front. But as the weeks unfold down the road, if this helps us get even more broad-based testing, or if again someone doesn't have to go to a medical facility where they might carry that infection with them into that medical facility to get the test. This is why the drive-up testing is so valuable, because it preserves lots of PPE and keeps people out of our facilities where we've got other people that may have immunoproblems, but that we don't want to expose. So keeping people with symptoms outside of that. So that's another, an advantage of this time of year, that weather's conducive for us to do the drive-up testing. But this could be another tool in the toolkit going forward. Online question?
Jean Schemp with Hometown Radio Group in Minot and Bottineau. As you acknowledged in your comments, there are still reports of people being turned away from testing. Is there more the governor's office or the state health department can be doing to work directly with health units or local providers to make sure people who should be getting tested are? And could these local health providers not be getting the message that they should be testing more?
Well, we're going to make sure, and this is something that General Schulte will be working on. We're going to make sure that all of our communication to providers, all of the guidance that we're providing, all of the concerns that people have about whether it's shortage of tests or who should get screened, and part of that. So I mean, as part of the early part of this message today is that we've got to have a statewide team effort on testing, and that's going to include people advocating for themselves to make sure that if you need a test, you keep working until you get a test, and for the health providers to make sure that they are ready and have all the test and test kits and capability, because we have the lab capacity, we've got the kits, we have it. I mean, right now, if you're certainly someone who's symptomatic or someone who's been in close contact with someone who's positive, we should absolutely positively have the testing capacity, and we need you to step forward if we're going to get our testing up where we need it to be. So in addition to the targeted testing that I'm talking about that we can drive and control, where we'll go in and test, everyone in a nursing home and all the staff, we're going to be doing more of that. But if you're we'll call that outbound, where we're going out and making sure that we're protecting the most vulnerable, but the inbound, which is individuals like you that have to say, hey, I'm going to go get a test, and the providers have to work together to make sure that we're driving those numbers up, because if we don't, we're not going to have a clear picture, and we put everybody at risk. Jeremy, and then Jacob.
Employees are concerned about how their employers are handling certain guidelines related to social distancing and that sort of thing. What should they do?
Well, I think number one is talk to your employer. I mean, I think the greatest, good companies have got really strong communications plans with all their team members. I mean, this is, like I said, an environment where, 4 weeks ago, we had 30,000 jobs open. Every employee was a precious commodity, and you didn't want, whatever business you were in, you didn't want to lose them because you were going to have a hard time replacing them. So I would say first place is talk to your employer, and whether that's human resources or direct manager, but I would make sure that you're heard loud and clear going within your own company. Secondly, if you feel that that's not being met and you think there's some issue that's related to labor, you can contact our labor commissioner. If you've got general ideas about healthcare practices that might include businesses that we've mandated closures, we're taking all kinds of inbound suggestions from business owners and employees as part of the work that the team is doing at Commerce, and so we're all ears if people have got concerns. We want to hear those, and we want to address them, because that's part of the way we move forward together. Jacob?
Are schools part of the reopening plan?
Right now, schools are not on that. If you look at the guidance of the, phase 1, phase 2, phase 3 from the White House, schools and universities that are currently closed are not part of that phase 1 plan. We are pleased, of course, here in North Dakota that all of our education institutions are running and delivering education, and that's going well. We haven't given up we haven't given up completely on the idea that we could have somehow, some way, bring back some of those traditions, particularly when we think about those over 10,000 seniors in North Dakota. I think that the inspiring pictures of, they were, I'm sure will be a historic marker in time, but the Air Force Academy graduation last weekend, where Vice President Pence attended, again, there's a way to do a live event with social distancing and get it done and not deprive people that have worked for all those years to get a degree. And maybe we'll see some, creative ideas coming out from the K-12 sector about how to potentially do that. But right now, that part of it doesn't have the issues. K-12 doesn't have the issues of unemployment. Teachers are getting paid, superintendents are getting paid, kids are getting educated. So there isn't the same level of concern there we have about businesses where we've mandated closures. So we're addressing those first in line as part of the reopening. One more question. Lane, you get the last one.
Governor, do you have a number or an estimated number of how many people are working across the state as contract tracers?
I don't have that number, but I'll get it for you. because we're trying to ramp that number up. And I know that we'd reported a couple weeks ago that we had as many as 250 that we had hoped to have trained and ready to go. But I know there's been efforts that are being stood up in some of the tribal areas, so that's a number we'll get to you. And I'm sure that if Vern Dosh is listening, that he's already on it. Okay. With that, I want to also say, I think, is it accurate for me to say that, Michele, are you available for press afterwards? We didn't have any questions for Michele. I'm going to take off, and we'll close out today's televised briefing. So again, thank you all that are tuned in today. Thank you for, again, shout out Purple Up to all those military children. Grateful for you, and grateful to everybody in the state that's doing all the positive things to keep us moving forward. And again, everybody can play a role in helping make sure that we're getting our testing numbers up. So thank you for that. And again, we'll see you tomorrow at 3:30. And Michelle's going to be available for local press here. She'll stick around for that. She'll take some questions. Thank you.